You talk there about the care of mental health services, psychologists and other things. And I think most people would reasonably say that should be the first order of treatment for young people who have gender dysphoria before anything else, in a medical sense, that sort of course is taken. But we know in Australia, don't we, Bernard, particularly say in Victoria, anyone who might suggest psychological counselling or any sort of mental health treatment for a young person presenting with gender dysphoria is at risk of being taken to court, potentially even locked up for trying to change them out of their mind, even though you just want them to have the best available medical support.
That's right, Peter. And now New South Wales is flirting with one of these badly designed and misleading prohibitions on so-called conversion therapy. I mean, the parallels between the UK with the Tavistock Clinic and the Australian clinics, led by the clinic at the Royal Children's Hospital, are very strong, very direct. The allegation in both cases is that the clinicians get fixated on gender. There is a disposition towards medical interventions and counselling which might help a young person become comfortable with their body, the only body they have, is seen as somehow unethical. It's interesting to note that the Australian clinics are probably more radical in their approach than the Tavistock, which is being closed down. At least at the Tavistock, they admitted that giving puberty blockers to kids early was experimental. There was no good evidence for it. And so they actually ran a study. Whereas in Australia, at the Royal Children's Hospital, for example, they simply introduced early puberty blockers as routine treatment and only later began research.
So, Bernard, if we were doing what Britain's done, we'd have an expert inquiry. We've now knocked back 3 of them, 1 in South Australia, 1 in Victoria and 1 in the federal parliament. If we were doing what Britain is doing and the reasons why they're shutting down this affirmation model at Tavistock, we'd actually be shutting down the unit at the Royal Children's Hospital in Melbourne, who also believes in this affirmation model. I mean, am I, drawing a wrong parallel there? Is that a fair comment?
Well, Peter, the medicine that's being given, the puberty blockers, is exactly the same. The weak evidence base is shared internationally. It's exactly the same. So there ought to be difficult questions for our health ministers and our hospitals to answer. If these drugs are no longer safe to be given to young people in England, why are they safe to be given to young people in Australia?